Hi there. This video is a look at the reports for managing blood pressure in our pathology system. And if you haven't already watched the kind of general intro to these reports, we recommend you start with that. This is just looking at what's specific to the BP pathway. First of all, these two reports here are where you retrieve the record and action the alert on the home screen. One of them is just to code the diagnosis and send the patient a letter. One is to process the home BP. The numbers for these tend to be fairly low, but you'll find it's a fairly straightforward process. You click on action next to the alert and just follow the steps. It should be very self-explanatory. This report is particularly useful if you've been running the home BP protocols for a while and you've got patients where perhaps someone's cancelled those protocols or hasn't done the sort of steps on those. That can be worth looking at. There's a couple as well of these pathway unclears. Tends to be where there's some kind of background process to do with CKD coding or Q risk. If either you've not got those automations in place or there's something that's not quite triggering, it's worth looking in those, and perhaps for this one particularly, just calculate the Q risk. And that's important because it helps determine what kind of letter they get and whether it includes a medication offer with a hypertension diagnosis. As ever, we've got the reports for not responding. Again, that's really up to you as a practice how you want to action those and whether you want to chase those or just leave that with the patient. Not surprisingly, this section here is unique to the BP pathway, and there's different categories here. So these are patients who need to have a home BP, and the numbers that are reflected in here should reflect your practice setup. So some practices, you've told us you're doing 24 hours ambulatory BP, particularly for patients with no hypertension diagnosis. Some practices, like ourselves, loan machines out, and then some don't loan and will send messages instead, essentially asking the patients to either get a machine themselves or borrow it from a friend or so on. These have been set up in a way to split between comms annex and letter templates, and we've set it up with this patient appointment invitation link. The reason we did it for these is we found that this was quite a good way of getting this arranged, where we could set up a rota, attach an appointment link to it, and the rota might even effect just be really with the receptionist, and patients could use that link to book in, come and collect the machine, and then bring it back a week later. Obviously, you don't have to work in that way. You could just use these as reports to message the patients to say, please come and collect the machines, or however you think is the best way for your practice. But yeah, the patients in here should reflect your setup. The eagle-eyed among you have noticed that there's some patients in there, so I'm going to double check that in a minute. That's probably just where we've not quite set that localization up quite right. And then finally got this one here, 2 invites and no response. So that's where they've had multiple invites and requests to do home BPs, and you might want to think about coding that as effectively declining the BP. Other sections will reflect how you're working as a practice. So on our spreadsheet, I've just been putting in here a little bit if it's going to work for me. That we are directing these clinical reviews straight to appointments, which is why there's no patients in there and why on the spreadsheet that's grayed out. If you've got it grayed out here, but you have got patients appearing in this list, then that would suggest you've not told us you want it to work that way. Drop us an email and we can change your settings and make sure that's working for you. Another section that's slightly separate, that's to do with coding. Historically, with this pathway, we used to code patients as suspected hypertension and then arrange follow-up tests like ECG and bloods. What we found was that some patients then didn't attend, and so kind of then never really got picked up. We've now changed the pathway to code them as hypertension, but a very sort of non-specific generic code. Then when the tests have been complete, we can code more accurately what kind of hypertension they've got. But these are ones to potentially look at where they've been coded in the past as suspected hypertension. They've not had the follow-up tests, and as things stand, they won't be invited for annual hypertension monitoring. So you may want to go back and potentially either change that code to suspected hypertension, from suspected hypertension to hypertension, or you may want to follow them up and make sure those patients get that input. Other things really much the same. So again, we've got no one in these discussed because we're directing those straight to an appointment. Same with the prescribing review. We've got those going straight to an appointment with a pharmacist. The comms in bulk, annex in bulk, again, are zeroed off for us because we've got all the automations enabled, and therefore patients are just in the retrieve and save report instead. Finally, there are letters that need sending in bulk where we're unable to send comms annex. Can't be automated, so it's important those are done as well. Hope that helps. Any issues, give us a shout. Thanks.